we work with very sick children from 1 month to 18 years of age. So we have the full range. And what we have noticed over the last 15 years or so is that we are saving many more children than before. Our mortality is coming down dramatically, but at the same time, the complexity of patients is increasing, and the number of children with chronic conditions, chronic complex conditions, is increasing because we are saving them from death, but now they become chronically dependent on technology and also with multiple admissions to hospital over time. So when that happens, then that's the importance of palliative care. Why? They're not dying, but palliative care is helping them to have a better quality of life. So that is our role, is that with these children with very complex and chronic conditions, that will have a life that is meaningful and very good for the family, but it's a life with limitations. And that is our role in the ICU, is to make sure that when they are there, we apply the palliative care principles. So that's a big change over the years, that we come from just saving children, now we're actually helping them with their chronic conditions to have a better quality of life, even in the ICU. In the ICU, we're trying to do is get the palliative care group being consulted more often, but even us intensivists with some palliative care training, which is in my case, we're trying to do things that will improve the care of the children in the ICU. For example, we have dogs coming to the unit, even with the kids on ECMO, for example. So that is quality of life while you're still very acutely ill. And we have child life that plays with the kids in the ICU. We have music therapy. We have art in the ICU. And we have the teachers that come from the public health system to teach while the kids are still in the ICU. So those are the things that over time we are seeing a big change. And I think this is due to the fact that people are more aware of that palliative care is for the living, not just for the dying. The challenges are, number one, is recognition of the importance of involving palliative care early on in some cases. For example, kids with very chronic and limiting conditions, for example, lung transplant candidates, intestinal, liver, multivisceral transplants, getting them to be seen by palliative care early on the journey so they can have a better quality of life as they wait for the transplant. And if the transplant doesn't happen, then they already are connected to palliative care. So that's one of the challenges. The other thing is that palliative care needs to be recognized by the health authorities, by the hospitals, to get their service paid. And I think this is something that we started voluntarily. We never got paid to do that kind of job. But now the hospitals see the importance and then started to recognize, start to remunerate. And that's very important in any part of the world, that people that do this kind of job be recognized, not just by their dedication and their love, but also having some monetary compensation. I think my first advice is listen to the families, which is the theme of this Congress. Parents know, and when they say something, pay attention, take into consideration. That's number one. Parents sometimes get into conflict with us. We need to understand and not judge, but we need to get into this open dialogue until we come to an agreement. That's number one. Second advice I give to people, my residents and people that start in this career, is that you have a great friend that you don't appreciate. And that friend is a chair. A chair. Why? Because when you start a conversation with the family and you sit down and talk to them, sitting, you're giving full attention. And a family that you sat with them for 5 minutes will think that you did it for 30 minutes. If you did the 30 minutes standing beside that family, they will think that you stay there for 5 minutes. So a chair is your best friend.